heard someone say they have PTSD, but you weren't quite sure what that really means? Many people think of post-traumatic stress disorder as something that only affects soldiers or first responders. But the truth is, PTSD can happen to anyone. It's a deeply human reaction to experiences that overwhelm our sense of safety, control, and understanding of the world. Today, we're breaking down everything you need to know about PTSD: what it is, what causes it, how it feels, and most importantly, how healing is possible. Section 1. What PTSD actually is. PTSD stands for post-traumatic stress disorder, a mental health condition that can develop after someone experiences or witnesses a traumatic event. That could be something like a serious accident, natural disaster, abuse, war, loss, or even ongoing emotional trauma. Trauma isn't about how big or small something seems. It is about how your body and brain respond to that event. When your mind and nervous system experience something so shocking or frightening that it can fully process it, it stores that experience as unresolved stress. PTSD is your mind's way of saying, something happened that I still don't feel safe about. Section 2. How trauma affects the brain. When trauma happens, the brain's alarm system, mainly the amygdala, goes into survival mode. It floods your body with stress hormones like adrenaline and cortisol, preparing you to fight, flee, or freeze. Normally, after danger passes, your brain calms down again. But with PTSD, that system stays stuck in survival mode, constantly on high alert, even when there's no real danger anymore. The hippocampus, which helps you organize memories and tell time, can get confused, causing flashbacks or nightmares to feel like they're happening right now. And the prefrontal cortex, the logical part of your brain, struggles to remind you that you're safe. That's why PTSD isn't just in your head. It's a physical and neurological response that affects your whole body. Section 3. Common symptoms of PTSD. PTSD looks different for everyone, but most symptoms fall into 4 main categories: re-experiencing flashbacks, nightmares, or intrusive memories that make you relive the trauma. You might feel the same fear, panic, or helplessness all over again. Avoidance. Trying to avoid people, places, or situations that remind you of what happened. Sometimes, even talking or thinking about it feels unbearable. Negative changes in thoughts and mood, feeling detached from others, losing interest in things you once loved, guilt, shame, or believing the world isn't safe anymore. Hyperarousal. Being easily startled, having trouble sleeping, irritability, or always feeling on edge. It's like your body never truly rests, even when you want it to. PTSD symptoms can appear weeks, months, or even years after the trauma, and they can come and go in waves, often triggered by reminders or stress. Section 4. Types of PTSD. There are a few recognized forms of PTSD. Acute PTSD. Symptoms last less than 3 months. Chronic PTSD. Symptoms last 3 months or longer. Delayed onset PTSD. Symptoms appear after 6 months or more following the trauma. And then there's complex PTSD, often called CPTSD. This develops after repeated or long-term trauma, such as childhood abuse, domestic violence, or neglect. People with CPTSD may experience deep shame, emotional flashbacks, trust issues, and difficulty with self-worth because the trauma was prolonged, not a single event. Section 5. Who can develop PTSD? Anyone can develop PTSD, regardless of age, gender, or background. But some factors increase risk: experiencing multiple traumas or ongoing abuse, lack of support after the trauma, a history of anxiety, depression, or other mental health challenges, working in high-stress or dangerous environments. It's important to remember that developing PTSD is never a sign of weakness. It is your brain doing exactly what it is designed to do, protect you from further harm. It just gets stuck in that protective mode. Section 6. How PTSD is diagnosed. A licensed mental health professional can diagnose PTSD through a psychological evaluation, usually involving a detailed discussion about symptoms and experiences. To meet the clinical criteria, symptoms must last at least 1 month and cause significant distress or difficulty functioning in daily life. But even if your experience doesn't meet every diagnostic box, your trauma and pain are still valid and worth addressing. Section 7. Treatment and healing. The good news is, PTSD is treatable. Healing doesn't mean forgetting the trauma. It means reclaiming your life from it. Common treatments include therapy, especially trauma-focused therapies like cognitive behavioral therapy, CBT, EMDR, eye movement desensitization and reprocessing, and prolonged exposure therapy. Medication, antidepressants, or anti-anxiety medications can help balance brain chemistry and reduce symptoms. Body-based therapies, yoga, grounding exercises, somatic therapy, or breathwork help calm the nervous system. Support groups, connecting with others who experienced trauma, can remind you that you are not alone. Recovery is a journey, sometimes slow, sometimes non-linear, but every step forward counts. Section 8. Living with PTSD. Living with PTSD often means learning to rebuild safety in your body and environment. Small daily habits can help, creating a consistent routine. Practicing grounding, like noticing 5 things you can see, 4 you can touch, 3 you can hear. Journaling or creative expression. Spending time with people you trust. It's also okay to set boundaries and take time to rest. Healing doesn't happen overnight, and that's perfectly okay. Section 9. How to support someone with PTSD. If someone you care about is struggling with PTSD, be patient. Don't push them to talk. Let them open up when they're ready. Listen without judgment. Help them feel safe, respected, and in control. And always encourage professional help if they're open to it. Simple acts of understanding can make a huge difference. Section 10. Final message. PTSD is not a weakness. It's a response to something that was too much, too soon, too fast, for too long. Healing begins when you stop blaming yourself and start understanding that your body and mind are doing their best to protect you. You are not broken. You are surviving. And with time, support, and compassion, you can begin to thrive again. If this video helped you understand PTSD a little better, consider sharing it. Someone else might need it too. And if you're struggling, please know that help is available. You are not alone, and you deserve peace after pain. Thank you for watching, and I'll see you in the next video, where we continue unlocking the mind, one diagnosis at a time.